to move into the anatomy for speech and swallowing. So we've covered the central and peripheral nervous system, and we're going to get into the actual anatomical structures that the CNS and the PNS give those signals to. I recommend as we're going through this video, you start making a chart, or if you've printed off a chart for your assignment, start filling it out. What the book does is really break down each of the areas of communication in the anatomy responsible for them, but it never brings the big picture together. So that's what the role of this video is for you, is to give you the big picture of the anatomy that we're looking at. It's primarily the areas of the face, specifically the mouth, and then we're also going to talk about the throat and a little bit about the chest area. So if you have a phone, camera, or a mirror around, I recommend that you pick it up and look at yourself as we're going through this, because you're a great study guide and a little cheat sheet when you're taking exams in the future. So first things first, we're going to go into the oral cavity. And here we'll start on the outside with the lips. Hopefully everybody knows what the lips are. They're just kind of encompassing the oral cavity. They're important for articulation and swallowing. And right behind the lips, if you curl your lip up or pull your bottom lip down, you'll see your frenum. And if you lift your tongue up in your mouth, you also see another frenum. Frenums are just connective tissue. Kind of keeps your lips from hanging down or falling too far on your down over your teeth, and helps your tongue from lollygagging around in your mouth. So these are just connective tissues. We're not going to really focus on them so much. I bring them up because your textbook talks about tongue tie or ankylosing, which is talking about the frenum under here being too tight. But we're not really going to focus on that in the class. Just know that that's a thing in your mouth. Next up, we have the gums. They're up here at the top. And those attached to the teeth or cover the teeth. And the teeth on the top and the bottom attached to the jaw. So we have the maxilla up here at the top and the mandible down at the bottom. That's our bottom jaw. Now let's go up to the heart, or roof of the mouth, and it's divided into multiple sections. So first up we have the hard palate. So the hard palate, if you press your tongue to the roof of your mouth, is that very hard area, hence the term hard palate. It's divided into two different sections, so don't get confused. We have the alveolar ridge, which is just behind the teeth. If you kind of rub your tongue against the area just behind your teeth, you'll feel some ridges or some bumps. That's the area of the alveolar ridge. If you move your tongue just slightly back in the mouth to that smoother but still hard area, that's the actual hard palate as we classify it. And then move your tongue even further back to the soft or squishy area. That's the soft palate or the velum. And I'll refer to the soft palate as the velum for the remainder of this course, just for consistency of terms. Now, extending from the soft palate, we have fascial pillars. And the fascial pillars are just these pillars on each side of the mouth. We have two types of fascial pillars. Right here I'm highlighting the anterior fascial pillars. We also have posterior fascial pillars. So if you're looking in your mouth with it opened wide, you should see a set of arches here in the front and a set of arches in the back. What rests in between is the tonsils, and some of you may or may not have tonsils, and that's okay. You'll still have the two sets of fascial pillars. Some people may not be able to see their fascial pillars very well. This area in the very back is actually the pharynx, what's known as the oropharynx, or the area of the pharynx that corresponds with the area of the oral cavity. Hence the term oral, and pharynx or throat. So when we're looking in the mouth, we just see the pharynx. And now, we'll talk about that in just a minute, so I don't want you to get too caught up on that. Now we're going to move to the tongue. The tongue is divided into three sections. Right here at the very tip, we have the apex of the tongue. So if you're touching your alveolar ridge with the tip of your tongue, that's the apex to the alveolar ridge. Next up, we have the body of the tongue, which is really that bigger area that you can see in your mouth. If you press your tongue to the roof of your mouth just straight up, ignoring the apex, that's the body of the tongue. And then finally we have the base of the tongue. And the base of the tongue you can't really see when you're looking in the mouth. We'll see it in just a moment when we look at a side view. But but it's an area that actually extends further down into your throat. Okay, so now we've turned the head to the side, and so let's highlight the big areas. We have the nasal cavity up here at the top, which makes sense, it attaches to the nose, and it's really, it's not hollow like it is in this picture. It's actually full of different turbinates, which direct the airflow through the nasal cavity to help filter it as it goes down into the lungs. And it also changes the way that our voice sounds if we direct that sound through the nose. Then we have the oral cavity that we just went through. I want to highlight two things on here. We have the velum. First of all, we looked at the velum on the side of the oral cavity in that last picture, but know that the velum actually has a nasal side, and it's actually a very large set of muscles that lift and close to touch the back of the throat. And then this is the part of the base of the tongue that I talked about just a moment ago that you can't see when you're looking in the mouth. So the base of the tongue really extends very far down into the throat, and it attaches to the epiglottis, which is this little flap of tissue here up at the top. And this isn't a very good representative of what an epiglottis actually looks like. An epiglottis is actually more of a cup shape. It's not just in this picture, it almost looks like a uvula. It's not really. It's a wider piece of tissue that stretches across the throat and extends down into the larynx. So the larynx begins at the epiglottis, and it extends down here in this area is the false vocal folds, which again doesn't highlight very well in this picture, but you'll see it better in the phonatory section. And then extends into the true vocal folds in the area of the glottis, and the glottis is just the space in between the vocal folds, and you'll learn about that more later. On this side we have the pharynx. So the pharynx comes first in the throat. So when we were looking in that other picture, if we go straight back here, if the mouth was open wide, we would be seeing just this area right here. But the pharynx is actually very long. It extends right here for the nasopharynx, which is the area of the pharynx that connects to the nasal cavity. Then we have the oropharynx that really extends down to the epiglottis here. And the pharynx is just a space consisting of muscles. And then we have the laryngopharynx or the hypopharynx. I'll talk about it as the hypopharynx, which is the area of the pharynx that is in the region of the larynx to the esophagus. So the esophagus extends down into the stomach. It's not actually open at rest, so this picture isn't a very good depiction of that. But just to give you an idea, there is a second tube. So when we're talking about air coming through, air goes down through the mouth or the nose, through the pharynx into the larynx. Food goes through the mouth, down the pharynx, into the esophagus. And so the pharynx is really our dividing or connecting tube that sends things the right way because we want food in the back and the air in the front. We have two parts of the esophagus that I've listed here, and we'll really only talk about it in the swallowing or dysphagia lectures, and that is the upper esophageal sphincter, which is just a band of tissue here at the level of the esophagus, and it's a muscle that keeps food from coming back up the esophagus into the throat once we've swallowed. And then we also have the lower esophageal sphincter that you can't see in this picture, and it's the same thing. It's a band of tissue muscle that keeps food from coming out of the stomach once it's reached the stomach. Alright, so now let's go into the chest. So we've talked about this. We have the nasal cavity, and this really does a better job of showing you the three different turbinates for the nasal cavity. And then we have the velum here. We have the oral cavity. We have the pharynx. And remember, we have the three areas of the pharynx. This is the epiglottis. This is the larynx. The esophagus sits in the back of the throat, and you can't see it in this picture very well. And the larynx extends down into the trachea, and the trachea breaks off with the bronchi into the lungs. I'm not going to test you so much on that. Just know that the larynx leads to the trachea leads to the lungs. So we're going to learn about the lungs and how the lungs function. We'll also talk about the intercostal muscles that attach to the ribs to support respiration or breathing. And then we'll talk about the diaphragm, which is the floor of the thoracic or the chest cavity. And it's really our driving muscle for respiration. So overall, these are the areas that we're going to talk about in the following sections, and we're going to get more detailed on these areas as we go into our actual modules for the different areas of communication. But just know overall that this is what we're looking at.